That's Jenny Rees, our health correspondent, who was out and about in Cwmbran earlier today. Listening to that is Natasha Asghar, Conservative member of the Senedd for South Wales East, and the Grange Hospital is on her patch. Good evening, welcome to the programme.
Thank you so much, Gareth, for having me. I'm so sorry that we're speaking under these circumstances tonight.
I gather that you were... This inspection was carried out in August this year. I gather you were in the A&E earlier in the summer than that. What was your experience of A&E at the Grange?
I was. It was my first time at the Grange. I'd come back from vacation and unfortunately had incurred some insect bites that kind of got a little bit out of hand and out of my control. So after going through all the proper channels, my GP suggested that I go to hospital. And it was by chance, in fact, I'd been told by a number of people since becoming a member in 2021 that if you do visit a hospital, try not to let anyone know who you are, because then you'll see the real side of what actually the public goes through when they go. Because when, as MS, as we do any visit, you tend to find that all the bells and whistles are put on as a show, and we don't actually see what reality is. But when I went to the Grange, I struggled to walk because obviously the bites that I had were on my leg, and not only was obviously it really badly marked, it took me a good 20 minutes to get to where I needed to be, which was A&E. Upon arriving there, I must say, and I agree with what the previous interviewee said, the staff there is absolutely fantastic, Gareth. Honestly, I can't criticise the nurses, the doctors, those who are sitting in the admin teams. They're all absolutely brilliant. But the waiting room is shambolic. It's not fit for purpose. There was, like I mentioned, there's poor signage, the parking is atrocious, and what's more insulting to anyone's intelligence is it's so uncomfortable. The previous interviews are absolutely correct. People are sitting there for hours and hours on end, and it's a painstaking, not just experience, but physically painstaking to have to sit in those chairs in those cramped conditions, waiting just to be seen. Yeah, and the report, the inspectors and the health board seem to agree with you, because there's talk now of that waiting room being extended, and it sounds daft, doesn't it? But comfier chairs, it does matter, but comfier chairs and better facilities being put in place. Does that at least provide you some comfort that particular complaint seems to be in hand? No, not really, because I complained about this in June, which was months ago. And, it's not just me highlighting the issues. Politicians across the board have been shouting from the rooftops, as well as patients themselves. So my frustration is, why hasn't anything been done sooner? I mean, the report that we've been hearing about today highlights a number of issues. Excessive waiting times are there, uncomfortable conditions, yes, overcrowding, as well as outdated medication and many others. And, I've written to the health minister today itself, because I've had constituents left, right and centre contacting me, not just on social media, but on phone, via email, demanding answers. And I've also written several questions, in fact, to just get some answers. But what's worrying to me is that the Grange will be the only major hospital in Wales staffed by nurses on days when the profession will be on strike. And I'm seriously concerned that the hospital is going to be severely overwhelmed going forward.
One of the problems we've highlighted throughout the course of the programme, we were talking about it an hour ago, so apologies if you didn't hear that part of the programme, but this universal problem, it's not just the Grange, it's not just hospitals in Wales either, it's across the UK, of bed blocking. So there are people in hospital who are medically fit to be discharged, but the social care provision simply isn't there for them. And neither government, Welsh Government nor UK Government, seem to be getting to grips with that in a way that moves people through the system. How worried are you about that?
If I'm honest with you guys, as a human, as a politician, look, I don't make any secret of it, even when I stand in the chamber and speak on it. I have an elderly mother. She's sick. She's disabled. She has a multitude of health conditions. So I can sympathise. It's not just my mum. There are plenty of other people out there who I have to consider and think about. I represent 600,000 people in my region, but it's worth mentioning that Wales has the longest treatment waiting times in the UK, the worst A&E waits, and slowest ambulance response times. And we're just entering winter right now. So, as well as targeted action at the Grange, which we're speaking about, as you mentioned, and I appreciate you mentioned it, health is devolved. It is a responsibility of the Labour government here in Wales. We must follow what the Welsh Conservatives are saying, which is basically calls to set up surgical hubs and winter war rooms. They're essential and imperative under the situation that we're in right now to make sure that we are all well equipped and prepared for what's coming ahead, which is going to be a very heavy winter on the health service. In
many ways, I know you say that it's worse here. It's a cigarette paper in some cases. A report out today, the highest waiting times on record, over 4 hours at A&E in England. Cancer waiting times, actually not that dissimilar between Wales and England. Wales at the higher end, but there are plenty of health board areas in England where it's just as bad. This is a much bigger UK-wide problem, isn't it? Where money, investment, a plan is needed. And if a week today, your Conservative colleague in Westminster, Jeremy Hunt, unleashes another dose of austerity, that's not going to make anything better, is it? It needs investment. It needs something done.
Gareth, can I be very honest? I sit on Public Accounts Committee in that Welsh, in the Welsh Parliament every week, if not every other week, when we have our meetings. And it's worth mentioning that the Welsh government, as you and I both know, and your listeners are, I'm sure, are aware, the Welsh government gets funding from the UK government. £155 million was sent back to the Westminster government by this Welsh government for not having spent it. They had the money, it wasn't used, it's gone back. So I'm sick and tired of everyone blaming the Westminster government, the UK government, the UK government. We need to look into our own backyard before we keep singing and dancing about Westminster creating all the problems, and we need to look at why on earth the money that was given to Wales wasn't spent in Wales for the people of Wales.
And they're not on here to defend themselves on that point. But look, thanks very much indeed for your time. That's Natasha Asghar, who's a Conservative MS for South Wales.